At the fourth floor KQD Center, the most commonly performed procedure is, of course, the basic Botox treatment. Among these, I've been noticing a growing interest in salivary gland Botox recently. Today I'll briefly explain what exactly salivary gland Botox is. Salivary gland Botox, as the name suggests, is a treatment for salivary gland hypertrophy, or enlarged salivary glands. So where are the salivary glands located? They are located under the ear, first, second, under the jaw, and lastly under the tongue. But the one under the tongue isn't visible from the outside, right? So we don't treat the one under the tongue, but rather we perform procedures on the two areas, under the ear and under the jaw. First, to briefly explain why salivary gland hypertrophy occurs, it can be congenital. But if we look at acquired causes, it's often related to eating habits, such as binge eating, excessive drinking, or overeating followed by vomiting. So while getting the procedure is important, it's also crucial to maintain healthy eating habits in your daily life. Now you might be curious about exactly where under the ear and under the jaw are. The area under the ear is here. When you clench your jaw, you can feel the masseter muscle at your jaw angle, and it's just a bit above that. If you look at comedian Kim Jong-hyun, you can see that this area in front here bulges out noticeably. That area is what we refer to as the salivary gland under the ear, and as for under the jaw, many people actually don't know exactly where it is and often confuse it with a double chin. So, if you press the tip of your tongue up against the roof of your mouth like this, the muscle pushes out under your jaw, making the outline of the submandibular gland more visible. So, if you try this at home, pressing your tongue against the roof of your mouth, and the area that pops out under your jaw is very pronounced and clearly visible, then getting Botox under your jaw would be a good option. Botox under the ears is helpful for refining the facial line when viewed from the front. This targets the jawline and the double chin area. Thank you. It will help to tighten up those areas. As you know, the procedure itself is very simple. It only takes about 1 or 2 minutes, and the effects are just like regular Botox. You'll start to see results within 1 to 2 weeks, and the effects peak around 1 to 2 months. So, for those who are particularly concerned about this area, it's good to get the treatment every 3 months. If you just want to maintain the results, getting it once every 4 months, about 3 times a year, should be enough. So, by getting Botox like this, you can manage your facial lines, and if you have a square jaw, it's also good to get Botox for the jaw area as well. Above all, as I mentioned earlier, right? I want to recommend once again that you manage your eating habits well.
But for people who get it frequently, you said they get it every 3 months. Doesn't that cause resistance?
Getting it once every 3 months is fine. Although it's unlikely that you'd get it more often than that, if you do, there are types of Botox with lower risk of resistance. It would be good to get Botox like Cortox or Xeomin. In the case of domestic Cortox, it's not that expensive and works very well, so honestly, I recommend getting a low resistance Botox like Cortox regardless of the brand.